Welcome, students. We're going to get started with our second section of Chapter 9 PowerPoint. So today we are going to be going all the way from slide 24 um, up to slide, let's see here, it's going to be slide 40. So we're going to be talking about quite a few different topics this evening. We're going to get into looking at suture materials, suture needles, placing sutures, suture removal. We'll also talk about sterilization techniques. So we're going to look at wrapping packs, instrument care, ultrasonic cleaners. We're also going to look at the difference between steam sterilization, gas sterilization, and cold tray. So those are the subjects that we'll be addressing this evening, and we will get started right now. So to start off for today, we have our suture materials. We're going to be looking at sutures quite a bit throughout the next few slides. So suture is described as any strand of material that's used to approximate tissues or ligate blood vessels. Now, there's some standard characteristics of sutures. They're usually monofilament or multifilament, and mono is singular, multi is, of course, multiple. So monofilament is one single strand of material, but versus the multifilament is going to be several strands twisted or braided together to use as one suture. Now, it really just depends on where the doctor's operating. They're going to use different suture materials on, the patient's abdomen versus the patient's face, like if they were operating on the eyes, versus dental surgery versus if they were operating on the joints, right, in orthopedic surgery. So it really is dependent. Something that you'll want to memorize about suture. You will want to know mono versus multi, right? The differences there, but you'll also want to know, how do we read the sizes? So they can be anywhere from super, super fine to really coarse, right? So really thin material versus thicker material. The finest material you'll see is, we go by sizes. The larger the number, the smaller or the finer the material, versus the smaller the number, the larger the diameter or the thicker the material. So like a 10-aught, you see this 10-0, we actually pronounce that as 10-aught. And that would be the smallest, again, size of suture. Versus we have coarse, which would be like 7-aught. So if the doctor's asking you, you would want to know, one, is it mono or multi? And then also your size. Is it 10? Is it 8? Is it 7? What are we looking at here? And they'll tell you that. Now, there are different types even further, right? So we've got our singular, we've got our braided, we've got our sizing, but there's also absorbable suture material. So we have suture material that we remove, and we have suture material we don't have to remove. Absorbable suture is ideal for dental surgery, right? Sutures in the mouth. It's also ideal for inner sutures, meaning internal sutures, like inside the body cavity, where we wouldn't be going back in to remove them. Absorbable sutures usually absorb within 60 days. So that's about 2 months they take to absorb. There's three different ones listed here. So we have surgical gut. It's also known as cat gut, and this is actually intestines from sheep or cattle. It's not used much anymore. It's pretty old school, but it's the idea of it is using like those organic materials, very thin organic material to use for absorbable. The most common that you're going to see is either chromic, but more than likely synthetic. Chromic surgical gut slows the absorption. Synthetic, this is synthetic absorbable materials. These are hydrolyzed materials which break down by a chemical reaction. They have minimal tissue reaction. They're easily available, and they're most cost effective on the market. So just keep that in mind, that there are absorbable and there are non-absorbable. Absorbable are used in areas where it would be hard to remove or internally, versus removable can be in any, external location where we can then remove it at a later date. Keep it in mind that sutures are kept in place for 10 to 14 days after the surgical procedure. So they will have these sutures in place for about 2 weeks before they come back in for their recheck. At the recheck, we'll check the sutures, we'll make sure that everything's healing correctly, and we'll remove them at that time if the veterinarian deems it's safe to do so. However, sometimes if the suture isn't, if the incision isn't healing properly, there's signs of infection or complication, we might not be able to pull them at that 2 week mark. Sometimes they do have to remain in place longer, but standard is 10 to 14 days. Again, we had absorbable and we have non-absorbable. So some examples of non-absorbable sutures would be like organic materials. That could be like silk or cotton. Silk can actually is most commonly used in braided multifilament suture. It can be coated or uncoated. And that just means that it has a coating over the braided strand versus not having a coating. Again, you don't really need to know those differences. It's more of just, again, learning your doctor's preferences and always asking. There's cotton as well. This is under the organic suture materials. This is does cause less of a suture reaction, less tissue reaction while using it. However, cotton technically supports bacterial growth, so it's not used very much. You'll see silk used often. You'll also see synthetic materials like polyester. Um, it also has coated caprolactam, which is a strong inducing little tissue reaction material. And those are multifilaments versus there's also monofilaments, which is polypropylene, polyamide, polyphins, polybusters. Again, just different synthetic type materials. And then we also use metallic sutures. I'm talking about like stainless steel. I'm usually looking at staples, skin staples, or wires that we can place, commonly seen in more orthopedic surgeries. Staples can be used for a lot of different soft tissue procedures for suturing. It's just not as common because they're not as pleasing to look at, right? As aesthetically pleasing per se. They can look a little aggressive, they can look a little scary. They don't tend to use staples as often. But they do work in terms of how it works for wound healing. They work splendid. They're a fantastic option. Okay, before we get into more about sutures, we're going to talk more about suture needles. We are going to go into our first break, so I am going to pause the recording now. Welcome back from the break, students. So let's now look at your next topic, which is suture needles. So we were just looking at suture materials. We're going to look at the needle that the doctors will use to place that suture. Now, these suture needles you're going to see throughout the next few slides. So they come in a variety of shapes and sizes, and it all depends on the tissues that the doctor's trying to suture, the wound topography, which is like the features of the wound, what they're trying to suture, the area, the tissue, all of it. So that all goes into what type of suture needle do they need to get the job done. Now, it's important to understand the parts of the needle and to be able to identify those. So for suture needles, they are what we call swagged, which means that the suture is actually threaded into the inside of the needle and it comes all as one apparatus. You would open it out of the suture, you would open it from the packaging, and it comes out as one entire piece, the needle with the suture attached to it. That is the most common way that you're going to see it packaged nowadays. Now, previously, old school medicine, we used to have closed needles, which means that we actually had to take the suture and thread it through the eye of the needle, just like a sewing needle, and then suture close that wound. So, the downside of having this eye on the end of the needle is it can technically be more traumatic. It can unthread while you're going through those sutures, and it just requires more handling skills with using it. So, not something that you're going to see very often. The only time that I really saw the closed method or an eye for the suture was working in large animal medicine when we worked with Ethelon. Um, which is a extremely thick and powerful suture that they used with horses. Um, Most importantly, when they were suturing from a colic surgery. The reason being is because they needed really heavy duty suture to hold that wound closed because it's on the ventral abdomen of a horse. And as you can imagine, that's a lot of pounds and pressure and organs that it's trying to keep hold in. So that is the only example that I can really tell you that I've seen the closed or the eye method for suturing. Otherwise, really every other type of suture you're going to use is already going to be swagged. It's going to be pre-attached um, to where the needle and suture are a combo. Now, there are different types of suture needles. As you can see from the image here, there's many different shapes and sizes, and some of them are half an inch long versus 5/8 of an inch versus 3/8 versus 1/4. There's many different to choose from. Some are even straight or even just a little bit curved. What I can tell you from this is that you don't exactly need to know what type of needle would they want to use with what wound or what type of surgery. You don't need to know any of that. What you do need to know is, again, if a doctor asked you for that specific type of needle, you would need to be able to identify that on the packaging. So your lab instructors, they're going to show you what suture packaging looks like, and they'll even put you through some scenarios when you're identifying suture. Again, you don't need to know why they need these needles or for what reason, but you should be able to identify them and properly open the equipment for them to use. Again, you're assisting them in that procedure, so you need to know how and how to identify and where to find these materials. And a lot of that just has to do with working in the job, with getting more used to it. The more often you're in surgery, working with these supplies, working with those doctors, the easier it's going to be for you. The most common type of suture needle you're going to see is probably this half-inch circle. Very traditional and common type of suture needle. Again, not to say that the other ones can't be used. I've also seen the half-inch curved used quite often as well, especially in large animal medicine. Even the straight. If we wanted to get even more complex with it, suture needles themselves in different from the shape that you see here, they can also be shaped differently just looking at the curvature. So some of them are round, others are cut in a triangle form, or even we would call this a conventional cutting or reverse cutting. And again, this is where the needle itself, it's either round, which is a taper, it's a conventional cutting, which is a regular type triangle shape, or it's reverse cutting, which is upside down triangle. Now, the reason for those, again, has to do with what is the doctor suturing. So usually the point will determine the sharpness of the needle. So our cutting needles are going to be way sharper than a taper needle. The cutting needles will actually cut the edge on the inside of the curvature. So it's ideal for really tough skin, going through really tough tissues and materials, versus a taper needle. Again, that's the one that's, oh, sorry, that's the one that is round here that you see as taper. It's got a sharp tip, but it's not cutting edge, which means it basically pierces and spreads the tissue out. It does not cut through it. So it's more ideal for like delicate tissue, internal sutures, and so forward. To go even a little bit further into detail, this is just showing some of those different points. Now, I just showed you kind of the main ones, which is going to be taper, uh, regular versus like reverse cutting, but there's also spatula point, there's blunt point, there's taper cut. So they have, again, different styles of the shape of needle depending on where they're trying to suture and what tissue that they're trying to go through. Um, as I stated before, you don't really need to know why we use certain needles in certain places, but being able to identify them is important. So looking at those suture materials and starting to memorize which ones your doctors use frequently, especially if you're working in surgery quite often. Now, aside from sutures, we also use other materials to suture, which are things like adhesives, staples, or even mesh. Tissue adhesives are going to include things like tissue glue, which in the veterinary field we call it vet bond or nexa bond, and it's basically skin glue, so it's perfect to glue the skin back together. Sometimes doctors will do this on top of their regular sutures, like they'll place the sutures and then they'll put a strip of glue and like glue it shut as well, especially if it's like in a high mobile area and they're worried about it coming undone. They can also just decide to glue shut the wound if it's a small enough wound or it's in an area where it's not high traffic or mobile. I've seen them use skin glue on things like neuter procedures all the time for neuters because the incision is so tiny, especially cat neuters. We use glue a lot for that. Um, Again, we use glue to reinforce sutures, making sure that they stay in place, or just for smaller, if they're removing a little wart or a skin tag, the vet bond glue might be a perfect alternative to having to use sutures. And it will absorb slash wear away as the wound heals. So it's not something that we have to go back through and remove. Now, another option would be skin staples. Again, these are metal clips that they use. Just think of almost like your standard stapler. We have medical grade staplers that we use, but it quite literally just staples shut that incision. Um, can be a great thing to use in a pinch or in an emergency. Not as commonly used just because it's not as aesthetically pleasing. It can look a little scary. So we don't use it as often. Used it quite a bit in farm animal medicine, though, I will say that. Now, the last thing on here is surgical mesh. So it's pictured in this image down below here. You can see the mesh weaving. This is used primarily to repair hernias. In animal medicine, we see umbilical hernias quite often, which is where a hernia will occur right where the umbilicus is, right? So think of your belly button. Animals have those too. That's where they were attached to the umbilical cord to their mother while they were in utero to receive nutrition and to grow. So it is very possible that when the let's say for example it's puppies when they're delivered and we're removing the umbilical cord, it is possible where it doesn't heal correctly and there is an opening within those, usually the muscular layers. What happens is that soft tissue will start to push through those openings, and that is a hernia. Now hernias can happen all over. It's usually an inguinal or it's a again, umbilical hernia. Those are kind of the most common ones that we see. And the doctor will make an incision. They'll place a surgical mesh where that hole is, and they might even try to suture together the muscles if they're able um, to prevent that soft tissue from pushing through. It can start to push through that hole and start and cause bulging in that area. And it can even push or tear all the way through, which is why we need to repair it. Now, usually, if it's an umbilical hernia, they will do the corrective surgery for that when the patient comes in for their spay or neuter, right? So when they're about 6 months old, that's when they're approved to get spayed or neutered. So they could do that surgery at the same time as the alteration surgery. That's very common to do both of them at the same time. During a spay or neuter, they might even do things like pulling of the baby teeth or residual teeth. Um, and also removing of the dew claws can be something that they do during that procedure as well. Now, surgical mesh is usually non-absorbable. It technically can be absorbable, but the kind that you're going to see most common, especially for hernias, is going to be a non-absorbable mesh. So it'll stay in place forever unless it were to be removed. Coming back to removing those sutures, I spoke about this a little bit earlier. We remove sutures about 10 to 14 days post-surgical procedure. So the pet will get sent home after the surgery and they will be at home to recover for about 2 weeks. And then they will come back into their recheck appointment. This is when we recheck the sutures, we make sure it's healing, we make sure there's no signs of infection. If all things are good to go, then we will go forward and remove the sutures. Now, as an assistant, this is a main part of your job. You will remove sutures all the time. The doctors will do the recheck, they'll verify that the sutures are good and they're ready to come out. If they give you the go ahead, then you will be the one to remove these sutures. The doctor's busy, they'll move on to the next room, and we'll do the nursing care. So I will be showing you a video on removing sutures. It shows some good drawing and then them removing the sutures on the animal. Now, I like to use curved hemostats and suture removal scissors at the same time. You technically could use your fingers to pull at the knot and then cut. I like to use hemostats. That's just preference. Your lab instructors will let you try those methods in lab, and they'll give you the opportunity to cut out these sutures and again to practice this method. So for today, I'm going to just share a quick video on removing sutures. Again, it gives some really good visuals in these videos, and then they remove it off of this puppy that you see here. So we'll watch through this video to give you a good visual, and then we'll go back into our slides into our next topic.
Hi, we're here today to talk about suture removals. So I've got to preface this that anytime you have a surgery or procedure done at Marshall Animal Clinic that involves skin sutures, it's part of the deal. It's a complimentary appointment to come in and have those removed. But some people have dogs that don't like to come to the clinic, or some people live far away. We have clients as far as an hour. So we just want to give you a little tutorial on how to remove sutures yourself. So the most important thing is we don't want to take them out too soon. The window that we tell people is 10 to 14 days. And when in doubt, lean more towards 14 days. So I just recently had my own dog spayed, and her stitches were really starting to dig in at day 10, and she was licking and itching. So the skin was healed, but the sutures, the material was actually irritating her. So we snipped them, but you don't want to take those out too soon. So there's 3 different types of stitches that you're probably going to encounter here at the Marshall Animal Clinic. So we're going to do a little knot lesson. This is a simple interrupted. So you see my skin in the knot. When you clip that, you just want to clip it on one spot. We don't want to leave the suture material under. So make sure you clip it above the skin and below the knot on one side, and you should be able to pull it out. The second and the most common one that you're going to see for a routine procedure is called a cruciate, and it's very similar to that simple interrupted, only it's shaped like an X. Same concept. You're just going to cut one spot between the skin and the knot. You do not want to leave anything under the skin, so when you pull it out, you should see a couple squiggles. And the last part, which is the hardest one to take out, and that is a simple interrupted. That's one line of suture with a knot on each end. And you have to be very careful. If you were to cut this in 2 spots, you could leave a little suture under the skin. We don't do this one very often, but every once in a while there is. So again, you can only cut it in one spot right near the knot and then pull it all the way through, which sometimes feels kind of creepy. So this is Lola. Lola is a rescue French bulldog owned by one of our technicians, and she was a breeding mama in her previous life. So she's kind of got a funky undercarriage here. And she's got some cruciate stitches down low. So we've got 3 of them. And you see how when I pull on it, we see our knot right there. And then we see 2 sides. I only want to cut one side. Now, I'm using a suture scissors. The best thing to use at home is a toenail scissors or even a toenail trimmer. So one side and pull, and that's what I mean by the curly Q. Second one, I just hold on to the string, cut one side and pull it through for a curly Q. And here is our last one. So it has been exactly 14 days for Lola's procedure. She's got a little kind of crud built up on her incision. That's fine, that's just some dirt and kind of some skin sebum, but I like to pick that with my finger and make sure that the actual incision looks good, and it does. So Lola, you're free to have baths and run and play and do whatever you need to do.
Okay, so that was it for that suture removal video. So to give you guys a good visual again of how you're going to be doing that procedure. With that being said, we're going to come back into our slides and let's keep on going for today. So next area or subject area that we're going to look at is surgical instruments. We're going to come back to look at surgical instruments, but we're now addressing how do we clean and care and do maintenance of these surgical instruments. We've already reviewed them. That was in part one. So now we're going to look at, again, how do we get them ready to put into these packs? How do we wrap them in packs? What is the sterilization procedure? So you will again get to practice this in your laboratories, scrubbing these packs, drying them, and putting them through that entire process. Things to know, general considerations. Whenever you're rinsing instruments, we will wash them under cold water as soon as possible after surgery because while they're in surgery, they're going to get bloody, there's going to get organic material that's going to stick to these tools. And so as soon as the procedure is over, we want to immediately rinse them to start to remove that organic material. Depending on where your hospital is located, they may have you use the tap water. They might not. Sometimes, again, depending on where your animal hospital is located and the quality of the water, if they have filtration systems or not, they might just opt to use distilled or deionized water instead, because tap water can have minerals that stain or discolor these instruments. So again, follow whatever procedure your hospital has in place. They're either going to have you use tap or the filtered water, or they might have sterile or distilled water that's available. Now, if you have any surgical instruments with multiple components, like the suction tools, you will have to disassemble those and clean those separate and then put them back together once they're completely sterilized or completely clean and ready to go into the sterilizer. If you're using any delicate instruments, and I'm talking about instruments for specifically for eye surgery, those are very small, delicate instruments that have to be cleaned and washed separately because we don't want them to clank into other surgical tools and break and have that risk. So we will do those separate if you're working with those type of delicate instruments. But for general surgery, all the tools can go together. You would only be working with those delicate instruments if you did work for a surgeon, a specialist in surgery. Now, we clean everything. If a pack was used in surgery, even if half the instruments weren't used, we're still cleaning all of it. We clean it all. Anything that came into contact with the patient that was opened in surgery, it all gets cleaned, scrubbed down. It'll get put through an ultrasonic cleaner. This is a instrument cleaning method that is commonly used in the veterinary field. And this is, again, we're going to wash them first, and then we put them into an ultrasonic cleaner, which will have a cleaning solution inside of it, and it exposes it to tiny vibrations and helps just clean it a little bit further before we put it into our sterilizer. It also is supposed to extend the life of the metals and the tools, so it's supposed to be really beneficial to use. We just load the tools in there, drop them into the cleaning solution, and set a timer for it's usually 15 minutes. Once the timer goes off, we then will rinse the tools, place them out on a towel. We'll open up all of the ratchets, which are the locking mechanisms. So we'll open up all the tools, we'll lay them out nice to dry. We spray them down with, it's called instrument milk. It's basically an instrument lubricant. And we lubricate the tools to make sure that they open and close really easily and they're not getting stuck or anything like that. And we leave them out to dry. Once they're all dried from that ultrasonic cleaner, right? We've done two different cleaning methods now. We've scrubbed them, dried them, put them in the ultrasonic cleaner, taken them out, laid them out, lubricated them. They're all set and dry. Now they are ready to to get packed and go into your instrument autoclave. Again, the instrument lubricating, they call it instrument milk. And it's a specific type of lubricant that we use for those surgical tools only. That's the only use for it. again, once we're all ready and set to go, then you're going to be wrapping your tools in a surgical pack material. Now we do double wrap, we wrap these tightly. Um, and again, we use indicators inside the pack and on the outside of the pack as well. Now, and I do actually have a really great video of me demonstrating this, and I would like to show you all that video. So just give me one moment. I'm just going to pull that up, that link from my other webpage. Um, in case you haven't had the opportunity to watch it, I did record a video when I was on Riverside campus when I was training another instructor. And it's a really great video about wrapping your packs. And again, if you haven't watched it before, you're going to watch it now because it's really great. So just give me a moment. I'm just going to pull it over here.
Okay.
It's about 5 minutes long, and it goes over me wrapping a gown and towel pack, but you're going to wrap the instrument packs the exact same way. So it doesn't matter what you're wrapping, you're going to wrap it the exact same way with this
Okay.
double wrapping method. Okay, so this is the video that I made. I am going to make this screen a little bit larger and we're going to watch this together. Again, this is in the video, I'm using a gown and a towel, but you could easily swap this out for your instrument packs and you would wrap it the exact same way. So we're going to go through and watch this video really quick, and then we'll get into looking at our sterilization techniques. Again, if you want to go back to find this video, it's under the videos and extra course materials section in your module. All of the videos from the lecture PowerPoints will always be found there. Okay, we'll go through this really quick. Okay, now that we have our towel and our gown folded, we are going to fold it up into our pack. So I am using a surgical drape here. You can use these reusable ones, these are cloth ones, or you can use disposable drapes as well. It just kind of depends on what your doctor and clinic has available. So what I'm going to do, I have my gown and my towel stacked on top of each other. An indicator strip will also go inside this pack as well. So what I'm going to do is I want to put it in the center of my drape, and I have it facing kind of like a diamond. So there's a point facing towards me, and this point is the first point I'm going to start with. So I'm going to place my hand on top of the gown and towel and put some pressure here. If I don't do this, when I go to wrap, it's just going to like fall right over. So I have to place pressure here. Then I'm going to grab the point that's pointed towards me, press down, and I'm going to stretch this drape up and over. I'm putting a lot of pressure with this. I'm going to lay my forearm down on the pack, and then I can remove my hand that's underneath. At this point, I'll kind of smooth it out a little bit, and then I can take that hand and place it right on top. Again, I want to keep this pressure. If I don't do that, the fold will fall out. So once I have this pressure here, now I'm going to fold back the top part of this drape and make a little tab right here. And that's what the doctor or yourself will pull on when you're opening up this pack. So this is my first fold, and I'm going to do this 2 other times, and then my last fold will be a little different. So once I do the side that's facing towards me, I want to do both of my side-by-sides, right and left folds, and then the side facing away from me will be my last one. So this is my first one. I don't like to awkwardly wrap from the side, so I'll actually just kind of move the pack to where that side that I'm folding is faced towards me. Then same thing. I'm going to stretch and go up and over. Using my forearm to go down, I can remove my hand, place it on top, pull out all of these wrinkles here, fold back this drape, and up and over to make a tab. Then same thing, I'm going to move it to the other side and do it for the other side. And you can adjust it as you're going. You want to minimize any wrinkles as you're folding these gowns. If there's wrinkles in your wrap, in your drape while you're folding, it will actually interfere with how the steam autoclave autoclaves your pack. These wrinkles here will prevent that steam autoclave from actually penetrating and fully sterilizing this pack. There can be a lot of, this is when we can see the indicator tape that doesn't actually turn color, or your strip is kind of half turned color. So your wrapping is very important. Okay, so now doing this third side here, same thing, up and over using my forearm, then placing my hand on top, getting out all these wrinkles, folding it back, and making that tab. Now you can see I'm at my last side of the drape here. what I did is I made a pocket, you guys. I made a pocket. That is what my last fold is going to go into. And if it's not tight, it's not gonna hold. So same thing, I'm gonna take the end of this here, go up and over using my forearm, placing a lot of pressure there. And then instead of making a tab, I'm gonna take this drape and tuck it into that pocket that I just made. And again, you'll adjust it if there's any wrinkles there, make it all nice and smooth. Your pack should look like so. So you can see this little tab that's up here at the top. Nice, tight, minimal wrinkles going around. Now I'm ready to wrap it again. I would do another drape on top of this one. We always double wrap our packs, but for this video's sake, I'm gonna go right into taping. So I'm gonna use an indicator tape, and you'll notice this looks like masking tape, but it's not. There's actually white diagonal lines going across this tape, and when it goes through that steam autoclave, it's going to turn black. So these lines will turn a very dark color when they've been steam penetrated. So how I'm going to label my tape is I need to put in there what's in my pack. Right now, I have a size large gown. So before you wrap your gown, you guys make sure you check the size. That's very important. So I put L gown plus towel because there is a towel in there and this is a pack. Then I put today's date and I put my initials. You'll also note that I tabbed both sides of these tape. Please tab the tape. You will thank yourself later. When we put this pack and tape through that steam autoclave, it pretty much cements it onto this pack. So if you don't have tabs, you're gonna be there for a long time trying to get this tape off. Now, how I'm gonna put this tape on this pack is I wanna put basically my first line where it says, large gown, I wanna put that right on the top. Then I'm going to stretch my tape up and over the tab and onto the bottom. So as we file it, as we put it away in our bins, we can clearly see what it is by just taking a glance at it. And as a final check, if you want to make sure if your pack is tight enough, I'm going to take off my tape first because that'll be cheating. I'm going to take this pack here and I'm going to give it a good old throw against the wall. Let's see if Miss Nielsen did this pack right. And it stayed, it's good. So that's exactly what we want to see, you guys. So that is how we will wrap a surgical pack with our draping. All right, I hope you guys enjoyed that video. And again, please make sure that you go and watch it, have it saved in case you need to review as you're running your packs. That's going to be in your module under, again, that's the videos and extra course materials section. So that in a nutshell is how you're going to wrap your pack using your indicator strip on the inside, your indicator tape on the outside. And again, general considerations, make sure that you're not wrapping it too tight / too loose, but tight is so much better. You don't want it to be too loose. You don't want it to have excessive wrinkles because that can affect the way that the steam penetrates the pack. So the tighter the pack, the better. You don't want it to come loose or come apart. Again, you guys saw me throw it at the door at the end. And that's kind of a little fun activity that you can do. But again, to check, is your folds actually tight enough to hold up? They should be tight enough to not come undone if you were to huck it across the room. That being said, once we're ready to place these into the autoclave, we want to make sure that we pack them properly into your autoclave. Now, it does depend on the autoclave that you're using. I'm going to show you in the next 2 slides. We're going to look at gas autoclaves and we're going to look at steam autoclaves. Both of them are different in how we load the autoclave and how we use the autoclave and what we can even put in the autoclave. So let's start to review the different types of sterilization. The first method is the one that you're probably going to use, which is steam sterilization. So this is using a steam autoclave, which uses high pressure high pressure and high temperature steam to sterilize packs and pouches. Your lab instructors will be teaching you about pouches. Packs are for multiple instruments, gowns, towels, things like that, drapes. Pouches are for individual instruments. So 1 or 2 instruments would go into a pouch, and that's for in case a doctor drops an instrument in surgery, we can then grab a pouch that has that individual sterilized tool and just open up that one tool rather than having to open up an entire new pack just for one drop tool. So you will see the pouches as well. Now, for steam, again, this is high pressure. And we measure that pressure by PSI. That's pounds per square inch. Now, usual PSI is around 15. It can be a little more or a little less depending on what type of cycle you're running on your autoclave. Usual temperature in your autoclave is around 250 degrees Fahrenheit. So it gets very hot. And again, uses a lot of pressure to sterilize. And remember, sterilization is 100% clean. The cleanest of all clean. It kills all microbes, bacteria, everything, which is why it has to be at such high pressures and high heat. Now, the time of your cycle will depend on the types of packs you're sterilizing. So if you're sterilizing whole instrument packs, those are usually 30 minutes. If you're doing pouches, that can be as little as 5 minutes. Now that means to run the cycle. You still have to give time to dry and to cool down, which is usually another 30 minutes. It is a fast turnaround time. Steam autoclaves, usually you'll have your packs within 2 hours from start to finish with going through that 30-minute sterilization process to the cool down to the drying. It takes about 2 hours, which is a really fast turnaround time, especially when you compare it to gas sterilization, which we'll talk about next. But before we go on to gas sterilization, I have another video. I'm going to show you guys a video on using a steam autoclave just so that you guys can see how they're loading it, how they're using it. The one in this video is one of the newer autoclaves, which I commonly worked with in small animal medicine. They're digital, where you're literally just touching buttons and it's pre-programmed and it's really easy. Depending on your campus, you might have a more old school version of an autoclave. They all work the same. It's just having to do more manual settings on your older ones versus automatic settings on your newer ones. Regardless, your hospital will train you on how to enter the settings for your sterilizer, but you should know everything up to that point. You should know how to make the packs, place them in there, make the pouches, label them, get them all ready. And then again, they will teach you what their specific machine calls for and the procedures. So we're going to watch through this video on the steam one, and then we'll go review the gas sterilization method. We're almost done.
We're going to load the autoclave. This first one is with pouched instruments. We have little holders that keeps them upright and separated so that the steam can circulate and do its job. It's on a tray that goes and fits in the autoclave. There are different sizes of trays and they can fit in different slots. This is just going to slide right in. Also, before you run it, you want to make sure and check your water levels. You've got your green area as well as your red area. As you can see right now, it's in the red. So we're going to put some more distilled water into this opening, and then I'll fill it up into the green. So we're going to load the autoclave with packs now. So you can either load them on the tray and then put it in, or put the tray in, then load them, which is usually the way I do it. In. I've got 3 different sizes, so it shows you how that goes. So, and as you can see, that's too tall at that setting. And I'm going to just sit at the bottom, and it's not touching the top. And then push it back, but not so far that it's touching the back of the machine.
What happens if it touches the back of the machine?
It's going to burn the wrappings and make a foul smell, and it's just not worth it.
It's not pleasant.
Again, you want to make sure that it's not touching sides or anything like that. I'm also leaving a little bit of space in between them, again, so the steam can circulate and do its job. You can also put pouches and packs in at the same time. If you're going to do that, though, you need to make sure and do the setting for the pouch. So if you're doing packs and pouches, you're going to pick the packs setting. Obviously, if it's just pouches, then you can just do the pouch setting. Distilled water.
So before we go on to the next thing, I'll show you real quick how she filled that almost to the top. It's way up in the green. Talking about not having the packs touch the sides of the autoclave because they will burn that way. It's equally important as well that the packs are actually on this tray. So this tray is a vented tray with holes in it. So as the steam does its thing, it will eventually, the autoclave is going to cool down, the steam's going to go away, it's going to re-decondense, whatever the word is, into just water, and it's going to fall down to the bottom of the machine, and then it's going to drain out through a drainage hole. And then sometimes, does ours recirculate, or does it just use? No, it doesn't recirculate. Yeah. So, but this is important because what happens is while the steam is important in actually sterilizing the instruments, you don't want these packs being sopping wet. And if these packs were down here, they're going to just sit in water and be sopping wet. It's important because if a pack is wet and you touch it, now the inside of that pack is considered not sterile because that water can take any of the germs that were on your hand, any of the germs that were on the outside of the pack, and then take it down into the inside again.
Up on the handle to push it all the way in and down to secure it. Those are packs. So pack one, it'll tell you, the temperature, the time, and then it fast spins for drying. And then you can just push start, and it's gonna fill. You generally can hear it making the noises as it's taking water into the main area out of the tank.
So once the autoclave is finished its cycle, then it is going to beep at you. It's going to make a loud clunking noise, which is actually the door opening itself back up again. And it's going to vent for a while. Just leave it be. Let it vent, let that steam escape, let the packs cool down completely. Because once again, you don't want to be touching wet packs. So sometimes when we're in a hurry and we want to get rolling with the thing, our tendency is going to be like, okay, autoclave's done, grab the packs. Just leave them sit. If ever you're in question, let them sit, let them dry.
Dental packs.
Okay, so that was it for our steam autoclave. So we just got a few more subjects left. We're going to look at gas sterilization next, and then we'll look at our last sterilization, which is cold chemical sterilization. So again, you just looked at steam sterilization. That's going to be the most common method that you're going to see in general practice. Hospitals and clinics will more than likely have steam autoclaves. That being said, if you work for a large, mixed practice hospital, a specialty hospital, a surgical center, even emergency centers, more than likely they're going to have a gas sterilizer on property. Now, these gas sterilizers, they sterilize equipment just like steam autoclaves do, but they use a different process. They use a gas called ethylene oxide. This gas is flammable and it's explosive. That being said, if used properly, we can use it to sterilize equipment. When this gas is mixed with carbon dioxide or freon, it will sterilize the equipment. And we can put equipment in a gas sterilizer that you can't put in a traditional steam autoclave. Think about it. You can't put things like plastic or any other materials that can melt in a steam autoclave, right? It's too high of pressure, it's too high of temperature. But in a gas sterilizer, it doesn't use heat or pressure, it just uses the release of gas. So you can put all of those items into a gas sterilizer, which again is why it's great for emergency medicine. It's great for large animal hospitals as well when you're having to autoclave things like buckets and halters and lead ropes and all of that. Now, these equipment, that are put into a gas sterilizer, we still follow that same cleaning and packing protocol that you saw for the steam one. Instead of loading it into a steam autoclave, though, you would load it into a gas sterilizer. So your equipment's going to be clean and dry and packed and ready before it gets loaded into the gas sterilizer. So I am going to show you a video about using a gas sterilizer, loading it, using the gas ampules, and running the gas sterilizer. The one downside to gas sterilization, you might be thinking like, wow, well, you can do everything with it. Why doesn't all hospitals use it? Well, the exposure to gas risk, of course, you run that risk and you have to have very special protocols and procedures that you follow to make sure that you're using it safely. They can be really expensive, and the turnaround time, it's about a 2-day long, 2 to 3 day turnaround time. It's not like steam autoclaves where you can get that pack back within 2 hours and use it again. It's 2 to 3 days it takes. So it's a much longer process. Again, there's pros and cons to both. Most emergency or specialty, they're going to have gas and steam. All right, so let's watch another video here on operating now the gas sterilizer. This will be our last video for today. And then once we're done with this, we'll go into our last sterilization method, which is cold tray. And again, AppDov, one of my favorite channels ever. Please check them out if you haven't already. They're great. Really great information and great videos that they have. Okay. All right, so we'll get started with the gas sterilizer.
Hi, my name is Anna. I'm a surgery assistant here at Dove Lewis, and today we're going to be loading and operating our gas sterilizer. The load of items that I want to be wrapped, you want to make sure that you wrap them according to your hospital's protocol. Typically, we wrap things that cannot be steamed due to the high heat, so plastics, things with batteries, other things that just won't be able to make it through the autoclave. I have the dosimeter that will let me know that the load that I have run is in fact sterile. I have a humidity chip. Humidity is very important to the sterilization process when you're using ethylene oxide, so I have one chip here. And then I have my ampule that contains the ethylene oxide that will actually sterilize the items that I have wrapped here. So I'm going to turn the sterilizer on, and I'm going to open the sterilizer here, and I can start loading my equipment. The first thing I'll do is I'll open up my bag. I want to make sure that I use a clean bag every single time, a new bag, just in case the previous bag had a puncture or something in it. I just want to make sure every time I run a load, I'm using a fresh bag. So I'll put that in here, and then I can start to load my items into the bag. And then I can start to add the things that I need. So I can open up my humidity chip. And I'll put that in the bag. And then I'll add my dosimeter. I'll put that in there. I want to move the ampule to the center of the bag just by pushing it like that. And then last thing is I'm going to put this in the bag. I'm not going to open the ampule yet, so I do that by breaking the tab off the end. I'm going to wait until the sterilizer is closed and the bag is purged before I do that. So I'm going to leave the ampule on top so I have access to it so I can open it through the bag. The next thing I'll do is I'll hit start. Then I will enclose the top of the bag around the vacuum, like so. And then I will hit purge on the sterilizer, and that will remove all of the air in the bag. Okay, so now that all of the air has been purged from the bag, what I'm going to do is I'll bring the bag out here, and I can see my ampule is sitting here on the top of the bag. I'm going to feel for the tab on the end, and I'm just going to break it just like that, and I can feel that it got very, very cold so that I know that it broke. And then I can go ahead and I'll push this bag in here. I'll close the door, make sure it's locked. And now I can go ahead and select the cycle that I would want to choose. So for this cycle, I have chosen a 12-hour cycle. You can also choose a 24-hour cycle if you would like. 24-hour cycles I typically use when I'm running quite a few items, things with more plastic content. So if I'm running oxygen tubing or something, I will run a 24-hour cycle. Or if I'm sterilizing our internal paddles for defibrillation, I will run those on a 24-hour cycle. If I'm doing that, I just want to make sure that I'm using 2 ampules and 2 humidity chips versus just 1 ampule and 1 humidity chip for a 12-hour cycle. So the last thing that I want to do is record on our log here the date and the time that I started the cycle and the time and the date that I anticipate the cycle to be finished. So I'm running a 12-hour cycle, but at the end of every cycle there is a 2-hour ventilation time. So really every cycle is 14 hours. So 14 hours from now I anticipate the cycle to be finished. So I will write this on our log here. Whoever unloads the cycle will initial that they unloaded it, whether or not it was okay. They'll know it's okay by reading the dosimeter. And then they will write the time that they anticipate the aeration time to be completed. So aeration time is completed 24 hours after the cycle has finished. And that's how we operate our gas sterilizer here at W.
Alrighty, so that was it for the gas sterilizer video. Again, using that ethylene oxide sterilization method. With that being said, we only have one last subject left. So technically there is one more method for sterilization, and it's called cold chemical sterilization. This is using a glutathione solution, 3%. Now, it looks something like this, where it's going to be in a instrument tray with a filtered tray on the inside. So there's holes on the bottom. So when you lift up that tray, the solution will filter out of it, and you'll just be left with your instruments. Now, this method is used for dirtier procedures per se. So for like wound repair, abscess repair, drain placement, your doctor might opt to use their cold sterile tools instead. However, there's been a lot of studies that have come out with these cold sterile trays and the organic material that can be left on tools and how effective really is using cold sterile. If we're not cleaning this often and we're not using strict procedures, these cold sterilization trays can actually harbor a lot of bacteria. So I spoke with the other instructors about this method because it's something that I saw very lightly. I honestly saw it more with like older school veterinarians that have been practicing for 20, 30 years. Again, tools at a grasp or at a pinch. I've seen cold sterile trays actually be used for suture materials than anything else. So rather than keeping like tools like what you see in there now, I've more commonly seen doctors place unused suture materials into this cold sterile tray. The reason being is if they're placing sutures on a pet and maybe they needed one more stitch, right? They needed to place one more, but they ran out of their suture material and we had to open up a whole new pack. Suture material is expensive. And so I've seen doctors that like, if they just used, enough for one stitch and they had basically a full strand of suture material left, I've seen them put it in the cold sterile tray to keep it sterile and then use it for, again, dirtier procedures like for wound repair, abscess repair, where bacteria is already present. So will you see this? Maybe. It's not as common anymore. Again, it's much better to use those other sterilization methods we looked at, but you still may see it around. I definitely have a veterinarian that I know is still using it faithfully to this day. And again, I've seen it more or less for for keeping sutures clean and sterile for the next use. Okay, students, with that being said, we're at slide 40, so we are going to end the PowerPoint here for today, and I'll stop the recording now.